for everybody. In the outset, I would like to thank the organizers, particularly Dr. Geripalcon Chennai, for giving me an opportunity to inaugurate this very important second national conference. Since I am associated with this specialty geriatrics nearly 40 years, I had some personal experience about elderly people. What was their position 40 years back? What is the position now? It is better to know about that. 40 years back, you remember correct, they die mainly due to infectious diseases like cholera, typhoid, plague, pox disease like that. So at that time there is no antibiotic, there is no vaccination, so there is no cure. So they will die much earlier. Before 60 they will die. So at that time there is no need for palliative care, there is no need for assisted living, there is no need for home for nothing at all. But now in the 40 years, the scenario has changed very much now. Now infectious diseases are very, very less because of the conquer of antibiotics. And we are seeing more number of non-infectious diseases. That is degenerative diseases are more common. You can see in the clinic, we are seeing dementia. A lot of dementia. I have not seen many cases when I was 30 or 40 years when I was doing house surgery in the hospital. No, every month we are doing 2 cases of dementia and Parkinson's disease, stroke, urinary incontinence, cancer, osteoporosis, obesity, so many things are there. What is the reason for that? It is because the change our lifestyle, thoroughly change our lifestyle. One good thing that increased better medical care, surgical intervention, antibiotic, early diagnosis, everything is okay. But are we really happy with that? People live at the age of now, average expectation of life in India is 72 years. You go to people's house, minimum 1 or 2 people will be there above 70 in their houses. So there is a longevity of increase, more number of old people, but they are not in a joint family. They are in the isolated, lonely family only. So if they are really happy, when they achieve 70, 80 years, are they really happy? Only very few percentage people are very happy because they can able to go for holidays, they can go for marriage, they can see the grandsons and great-grandsons, daughters, everything is okay. That is only very, very small percentage. But majority of persons are affected with the chronic diseases like dementia, depression, Parkinson's disease like that. This is a long-standing treatment. We cannot cure, we cannot only treat. Please remember all the diseases what we are facing now, we cannot cure. Can you cure dementia? Can you cure Parkinson's disease? Can you cure? But we can only treat. So what happened, this leads to bedridden patient for longer period of time. All the degenerative diseases we cannot treat for 1 week, 10 days like a infection disease like that. They need to admit or need to house for longer period of months to years together. So this involves a problem for the patient and problem for the caregivers also. The elderly people are so much depressed. Why I live for such a long time? What's the benefit? What I'm gaining because I'm lying down for a long time? Same thing happens for the caregivers. Initially they're okay, they're very happy to give treatment. As days goes on, how long we have to bear this? Medical expenses, physical expenses, doctors, so many things are there. They come to stage of frustration. So this is the scenario what we are saying now. Here comes the role of geriatrician, oncologist, and the palliative physicians. So this is a group therapy. So we have to combine together and give a treatment. Elderly patient, many people time I ask them, are you worried about loneliness? No, sir, I am not worried. Are you worried about the poverty? No, I can manage somehow. Are you worried because you are lonely? No problem. Are you worried about the diseases? No, I can get treatment. Then which worries most? He said, in the dependency. Dependency, this is one of the disability. For everything you have to depend upon somebody. Just imagine, or example give you, one Parkinson's disease, with the advanced stage, he is sitting in a chair, in front of the table with a cup of water, he is feeling very thirsty. He wants to drink the water. He cannot shout because Parkinson's disease, he cannot say clarification. He cannot get up and go to the chair because mobility restricted. He cannot talk, he cannot write in the pencil. So there are tears in his eyes. Somebody Either daughter says, do you want to have water? Yes, I want to have water. Then he would. Just imagine the situation. If this happens for months together, years together, then he said the worst thing in old age is a dependency. This is what happening in the palliative care. Number of people are bedridden. They are totally dependent upon the care of the nurses or care of the doctors and so on. So what I need, elderly people, many times I ask them, are you fear of death? No, sir, I am not fear of death. Then what fears most? The suffering at the time of death is I am fear about that. I am not worried that death is going to happen anyhow for everybody. But I am worried about the suffering at the time of death, like pain, breathing difficulties, stomach pain, so many things are there. These are the places where the palliative people are coming to help them a lot. And finally, elderly people, you know all about this thing, they don't want to end their life in the hospital or in the nursing home. They want to give away their life in their own houses, own place where you can see their loved ones and spend more time peacefully. They are then putting in the nursing home and other things. Today, many elderly cancer patients induce uncontrolled pain, functional decline, emotional distress, and social isolation, despite advances in cancer therapy. This gap highlights the vital role of geriatric oncology and palliative care workers together. So finally, there are only few suggestions from my side. First, we urgently need more nursing homes and facilities dedicated to terminally ill patients, similar to structural palliative care centers. First, we need more geriatric palliative care centers. Number two, integrate medicine. It is very, very important. We should not compose only the allopathic. Some elderly people are more associated with the Ayurveda, Siddha. To respect their feeling, we can also introduce with the help of the elders, you can also start giving the alternative medicine. Integrate medicine system with suitable alternative therapies which help to improve comfort and quality of life should be promoted. Third, there is immediate need to include degree or diploma course in palliative care, trained professionals in the field of, there is an intimate need to introduce degree or diploma course in palliative care. Trained professionals in the field are the need of the hour. Once again, I thank you all patiently for listening to me. I wish the conference every success and hope to contribute meaningfully to improve the care and dignity of the elderly population. Thank you very much.
Thank you, sir, for the insightful inaugural message. It's time to felicitate our dignitaries. I request Dr. Geripalcon Sridhar to honor our chief guest, Sri Dr. V.S. Natarajan.